When approaching any casualty, you should perform a primary survey following the Dr. ABC framework, first assessing if it is safe for you to approach them, then checking their response. If the person is unresponsive, shout for help, open their airway, and assess their breathing for 10 seconds by following the listen, look, and feel guidance. If a casualty is unresponsive and not breathing normally, you will need to both start CPR and call the emergency services immediately. Performing CPR on infants is a very similar process to performing it on an adult. However, there is an emphasis on rescue breaths. CPR is most effective when performed on a hard surface like the floor or a table. When giving CPR to an infant, the process begins with 5 initial rescue breaths. If a CPR face shield or valve mask like this one is immediately available, this should be used when performing rescue breaths. However, if you are alone, you should not interrupt CPR to retrieve one of these. In order to perform rescue breaths, you should make sure the casualty's airway is open. Give 5 initial rescue breaths using either your mouth or a valve mask if there is one available, making sure you have a good seal around the mouth and nose, and either breathe out or pump air into the infant's mouth for 1 second until their chest rises, and then allow it to fall before repeating another 4 times. After the initial rescue breaths, you should move on to chest compressions. Chest compressions should be performed as follows. Kneel close to the casualty to their side. Place 2 fingers in the center of the infant's chest. Push down with the fingers, pushing the infant's chest inwards around a third, and then release the pressure and allow the chest to rise. You should repeat this 30 times at a rate of 100 to 120 pushes per minute. After performing 30 chest compressions, you should perform 2 rescue breaths. When performing rescue breaths on the infant, you should use the same technique that was used during the initial rescue breath stage of CPR. It is essential that chest compressions are not interrupted for too long, so you should only ever perform 2 rescue breath attempts. This is regardless of whether or not the attempts are successful. You should then continue with 30 more chest compressions.